all our Herald TV viewers, a warm welcome. You are witnessing health and happiness. And amongst all the episodes that we have been sharing with all of you, they have been mostly on medicinal, surgical, and the common diseases that we come across. Today's episode is totally different because very often we neglect the entry to our digestive system, and that's our mouth, and we have these precious teeth that God has given to all of us. We take their care as granted, and therefore little attention or little care is given to the teeth. We have with us a gold medalist, best all-rounder when she did her post-graduation in the Goa Dental College in orthodontics and dentofacial orthopedics. She is our own, very own Goan, hailing from Kalangut, and she has been in this profession. She has got her own clinic, her own dentistry for the last 16 years, and it's a proud privilege for me to welcome the one and only Dr. Nadia Pinto de Souza. Welcome, Dr. Nadia.
Thank you very much, Mr. Lopez.
Yeah, we'll start with something different. And what made you to get into dentistry?
Well, that's a nice way to start off. In fact, when I was a small child, I had a lot of dental problems. And my mother would take me to this dentist who was very kind and caring. As I grew up, I realized, why not choose such a profession where you can be kind and caring towards someone? Luckily, I worked hard enough to be able to join dentistry at the Goa Dental College and be able to fulfill my dream of caring and serving the people and ensuring they have good smiles.
For the last 16 years that you are there, you must have had different sorts of experiences. And times are changing, technology is changing. What has been your experience for so many years now?
The experience has been fantastic, from being able to treat little children, to get them aware of coming to the clinic regularly, to getting their parents have their teeth checked, and to the use of the best equipment that is world class. I think that's a great experience that I've had.
Yeah, and normally now we see that mostly parents bring their children. In our days, it was not so. But I think things are changing, and they take a lot of care, especially for the children. And are the adults are also taking similar care?
I'd like to change the topic about this a little, because the parents, I think, don't take so much care. Not all the parents take care of their children's teeth, because they believe they are milk teeth and that they will fall off soon. But they don't understand that those teeth of the little ones last till they are 10 or 11 years. So they should have good teeth so that they have no pain. Now, how we start by doing that is by bringing them to the clinic just to get friendly with the dentist from the age of 2 onwards.
2 onwards?
Yes.
Okay.
That's when they have all their milk teeth in their mouth, and so it's very easy for them to become the friend of the dentist and not be scared of the dentist. As the child gets used to coming to the dentist, I see parents who then start saying, okay, it is really worth doing a dental checkup, and that's how we've been able to merge pediatric dentistry, that is little children, and the parents having their teeth checked up together.
But most people have this fear factor. Going to a dentist, my God, it is so painful, and the whole process.
Yes, you know, I just had my appointment last week because I had a small little filling to be done, and oh my God, that sound of the drill is actually the thing that puts you on the edge, and then you're very scared naturally, because your mouth is so close to your thinking center, and you're worried that at any point of time you could have like some pain. So that is basically a way of you know, the body's way of saying, okay, you better be careful, you may get hurt. So everyone is scared. But at my clinic, I promise tender loving care, because that's very important for the patients, and I have a few tricks which allows them to calm themselves before the appointment.
Yeah. Why do you think dental care of the teeth especially is very important?
Okay, so you know, our mouth is the gateway to our body. So whatever happens in our mouth can get into our body if we don't take care of it. The first thing is, if you've seen, there are people who have deposits on their mouth, so on their teeth. If they are not cleansed, they are full of bacteria. So if you don't remove that bacteria, you're swallowing it. And then it can go directly from the gums into your bloodstream, into your heart, into your blood supply. So it's very important to maintain good hygiene of the mouth to be able to be healthy as well.
But people take for granted, and they say that teeth are meant basically as part of making the food reduced into very, very small particles. That's all.
Yes, but sometimes if you remove your teeth, it is very difficult to bite. And if you cannot chew, then how will you swallow nicely? What happens is you have a lot of digestion problems then. But the teeth is also maintains function of your jaw. Many people who don't have teeth or have their teeth missing suffer from a lot of headaches and neck pains. It's all a complex system of our head, face and neck with the rest of our body. And everything starts with one tooth and then all of them.
Yeah, all of them.
Yes.
So if you don't take care at the initial stages, then you can worsen the entire scenario.
Yes. There is a saying which says that dentistry is not expensive, neglect is. You know, I find that really true, because whenever I have patients coming to my clinic, they'll say, "Doctor, it's so expensive." But you know, we have to save a particular tooth. So what happens is, at that point of time, you've come when there's already pain. And that time, the treatment is more expensive.
So one should do the checkups regularly.
Yes.
So now, how regularly do you think?
We first start with every month. You know, when there's a patient who comes with a lot of decay in their mouth, we say we'll do the treatment and then you come after 1 month. Once we find that you are better, I do a 3-month visit. If there's anything to do, we do it at that time, and then we call the patient at 6 months. But what is most important is I leave them with a lot of instructions. They can't just come for their teeth, get the work done and say goodbye to me and that's it. They also have to do their homework. 70% is theirs, 30% is mine.
Okay. And when do you actually start right from the beginning visiting a dentist?
Okay. Now for children, as I said, it's nice when they first have all their milk teeth. That's around 2.5, where they just come to open their mouths to the dentist, maybe just side by side, have a look, have a chat, or see their parents having checked. And this goes on every 6 months, which is ideal. For the adults, they normally come when there's a problem.
Yes.
But the minute there is a little bleeding of the gums, or if there's a little food getting stuck, don't wait. Visit your dentist immediately, because if we can catch it at that time when it is small, we can nip it in the bud. And that way you will be saving pain, yourself from pain, and saving yourself from spending a lot of money on your teeth.
Yeah, but normally people concentrate on brushing, using a toothbrush and buying a toothpaste. That's all.
Okay, Mr. Lopez, what have you grown up with the idea about brushing? How many times have you been told?
Twice
Twice
a day, morning and evening. Yes.
Okay, and what about any other things that
Flossing came later on.
Fantastic.
So these are the two things that have been told to us.
Okay, it's very nice. You've been doing almost everything nicely. You have to use a soft toothbrush because
Yes.
our teeth are very gentle, and especially near the neck where the gum and the tooth start, they meet, that area is very slim. So you want to brush gently, so you use a soft brush.
But most people, they say not soft brush, but the hardest may be, it has to last for many months or years perhaps.
No, a brush has to be changed every 2.5 to 3 months. Please note, it's very important for your health because you get bacteria growing on the brush. So you need to discard it in 2.5 to 3 months.
And brushing, normally they say in the morning and in the night. And flossing, what is
Yes.
your view on all this?
With my experience in this field since the past 16 years, what I've seen that brushing at nights before you go to bed is really very good. It's a good habit because that's when everything starts changing. The bacterial flora, the acid, So you need to have teeth without any food on it. So after, before you go to bed, after your dinner, give it some time, like half an hour, 20 minutes to half an hour, and then you can brush your teeth. In the morning is where I prefer you just brush after breakfast.
Normally people do, you get up and you brush.
You brush, yes.
Yeah. So it means before the breakfast.
So it means that if you've brushed in the night, when you wake up in the morning, you will just rinse your mouth nicely, have your breakfast, and then brush your teeth. Why? Because your teeth will be clean till the next time you eat something. But if you've brushed before breakfast, that means there's already little dirt stuck between your teeth or on your tooth, and then the decay process will start, and we want to avoid that and prevent decay.
Yeah. So, what about the toothpaste? Is any toothpaste good, what we get commercially now?
Ideally, it has to at least be a toothpaste with fluoride. Okay, especially for everyone above 6 years of age, a fluoridated toothpaste is recommended. In my experience again, which has helped, is I cannot tell you what toothpaste to use. What suits you may not suit me.
Yes.
Or what I write for you may not suit you. So I tell my patients that you choose a toothpaste which suits you best, change them every now and then. They have to have fluoride. So just check the ingredients that contains fluoride.
Before the toothpaste came and maybe toothbrush, I've seen people in Goa in my younger days, they used to take charcoal, sometimes leaves and some branch of a tree, and they would just brush.
I remember using the guava leaf myself when I was little and brushing my teeth. Those habits have now changed and everyone is going towards using a toothbrush.
Yes.
But using a soft toothbrush is mandatory.
Yeah. And toothpaste is also mandatory.
Toothpaste gives a freshness, and there is a component in the toothpaste which helps in cleaning the teeth better. So yes.
And we talk about flossing.
Flossing. Again, in my experience, I wouldn't say floss every day. I would say floss every alternate day. Give your gums some time to get back to its normal, because if you keep flossing, I have seen that the gums get hurt. So flossing every alternate day at least, or twice a week, is something that is a good habit incorporated in our weekly tooth
And
maintenance.
are different types of flossing now?
Yes, now we have the water flosser.
Water flosser?
Water flosser, yes.
Okay.
So it's a gadget. It's a small gadget where it has a nozzle. You fill that gadget and then you keep pressing the button which sprays
It
water.
sprays,
Yes.
okay. This is something
it's
new.
It's like a jet, yes. It's like a jet which you direct towards your gums, in between your teeth. And all that plaque and whatever food collects comes out. And I've seen patients who are using that properly. Their gums are quite good.
Yeah.
They don't need to floss every day.
Okay. And normally, people do not know how to floss.
Yes. The dentist has to do that.
So a visit to the dentist
Yes,
will
yes.
definitely help.
It's important for a patient to go in for cleaning of their teeth. Cleaning is called scaling and polishing, wherein we remove those little brownish or black spots that you see around the gums. Now once that is done and we polish your teeth, we then give them instructions on how to maintain that. Brushing, flossing. A new thing is use of interdental brushes. Have you seen people use toothpicks?
Yes, normally after your lunch or dinner,
Yes, yes.
toothpicks are a must.
Yeah, so we advise them not to use toothpicks because sometimes it's a wooden wedge which breaks and then causes infection. You get little picks with like a brush at the end. That is to be put between the gaps so it cleans that area well.
This is something new that I'm hearing from you.
Yes, this is something that also helps when the gums start receding or going down. You get little black triangles between your teeth which can be cleansed with the interdental brush or the water flosser.
But normally they say that going to a dentist is pretty expensive, especially in Europe. Whenever I have been there, they say we like to prefer to come to Goa now. Yes. And they say in your area, in the coastal belt, they say this is very good dentists who are there and they charge a very reasonable rate.
Yes. I don't think we fleece the tourists. We give them world-class dentistry here in Goa, and I think if we do a good job, ethically straight, then I think it's a very good thing to have dental tourism, because yes, the tourists cannot afford the charges in their own country, and sometimes they feel that their holiday included and their dental treatment will all be cheaper than what they would spend in their country. So I think we should grasp that and be able to offer them ethically correct dentistry, so that the name of Goa is high in those standards. That is important, right?
Yeah. Normally, when people come with their problems, normally are they at the initial stage or at an advanced stage? I'm talking about the Goans per se.
Okay. Normally it's at an already advanced severe case of dental decay.
Yes.
Or cavities in the teeth.
That means educationally there is something lacking.
Yes, definitely you hit the nail on the head. We definitely don't have a lot of dental and oral hygiene talks in schools, not just to the children but also to the teachers, maybe employees of different companies, maybe just generally speaking to people, maybe at their religious gatherings or parties. Sometimes it's good to just talk about having good teeth, maintaining oral hygiene,
Yeah.
which is lacking.
Are you also involved in this type of educational programs?
Yes, yes. I go to visit a few hotels. I speak to their staff. I speak to the staff. I've spoken to the staff of some motor places also, and where we get them used to, knowing the importance of maintaining cleanliness of their teeth and trying to prevent what can be done, or treating them when it is at the initial stage.
And mostly people do not know the correct method of brushing. When you say, up and down, people go always laterally.
Yes. Yes, that is something I show my patients on a model. I have a model with a brush, but you have to hold your brush at a 45-degree angle. It'll be difficult to tell here. Maybe next time, if I'm called back here, I'll be able to bring that big brush.
Sure,
and
yeah, it will be nice.
Them.
It will be nice.
Yes,
yeah,
I think
yeah.
that will be a nice thing to do.
Yes. So it also depends on how you brush.
Very much. You can brush 3 or 4 times a day, but if you don't brush correctly and remove the dirt, I think it's not
So
done
brushing
well.
correctly is more important than brushing X number of times,
Yes,
not
absolutely.
correctly.
Absolutely.
Yeah.
Absolutely.
And normally they say that food, if it is very acidic, then it hurts your the health of the teeth.
The teeth. Acidic food results in erosion of the teeth. That means the topmost layer of the tooth, which protects the rest of the tooth, that gets hurt, and then you start feeling sensitivity. So there are foods that cause decay and there are foods that can prevent decay. Have you heard of that?
Yes.
Okay, very
yes,
nice.
yes.
So things like that cause acid will always cause decay, whereas things like maybe a peanuts, walnuts, they have anti-karyogenic effect, means they do not allow decay to progress. Even a piece of cheese, if given in children's tiffin boxes, will prevent decay rather than giving them biscuits. So that's what I tell my patients. Sometimes give the children a few vegetable slices, so that at the end they can have those slices, and that will actually change the bacteria or the acid regulation in their mouths, or some nuts or even some cheese.
And I have heard few parents who say that I tell my child you can have sweets, but I tell the child you carry a brush with you. Every time you eat sugar coated or with something with sugar, you need to brush. Is it correct?
By the textbook it would be correct, but it doesn't happen.
Yes, it does not happen.
So what we do is we tell parents, if you want to allow your child to eat sweets, let them eat it after their major meal, so that they're not snacking continuously in between. And to be more realistic, I would say after you have something sweet, you rather rinse than brush immediately.
Yeah. So these are the messages that should go at the school level.
I would say first the parents need to be educated.
Yes.
So we always start with educating the parents, and then naturally the parents will put it forth to their children. I think when there are these neonatal and antenatal classes, that's when parents have to be made aware of the importance of their children's teeth before they are born.
But recently the trend is most children have some dental problems. It wasn't the case in the earlier days.
I think that's because our diet has changed. So we tend to give them a lot of rewards like chips and maybe a juice, and we think that that's it. More than that, I think parents say, oh, the child is not allowing me to brush their teeth. The way I would say is, do you allow your child to cross the road on their own? No. So why would you allow them to brush their teeth on their own? You have to protect them in the same way that you would protect them from getting hurt in any way. Would you like parents that your children's teeth should hurt? So how do we prevent it? By you brushing the teeth for them. Sometimes a little tough love goes a long way because the child does not have complaints then.
Yeah, but then for that the parents must know the right methodology or the technique, and they themselves are not aware.
Sometimes, yes.
Yes.
But there are some parents who go out of their way to, especially now, watch a few YouTube channels and all on how to brush their little one's teeth. But I'm always sure that if they have a good relationship with a dentist, it's a lifelong relationship where you can trust a person who will give you great advice, good advice and sound advice so that your teeth are good.
Yeah, and sometimes the doctors are of the opinion that if you don't have a good set of teeth, especially as you grow older, then it can have a lot of side effects, even heart problems or strokes and things like that.
Yes, there are a lot of studies that show that if you have a lot of tartar, for example, tartar are those brown deposits which are in your teeth, that causes a gum problem, and that has, the blood supply is directly linked to your heart, and many people don't realize it. Sometimes even if you have high blood pressure, you can see it in the mouth, and a good dentist will actually pick up those things, you know, like diabetes, high blood pressure. You can see it because there are some changes that happen in the mouth, and if you are able to pick that up, they are able to treat them easily.
Okay. Have you come
Yes,
across such cases?
Many patients.
Is it?
Many patients, especially diabetics, they have a certain pattern of decay happening in their teeth. Then we have people who have the problem with saliva. Their saliva is either thick due to some reason. You know, all that is seen in the mouth as decay. I've had patients who are being treated for hypertension, that's high blood pressure, and because of the medicines they take, their gums are swollen.
Is it?
Yes. Now in those cases, we need to have a relationship with their general physician or their physician who will be kind enough to have the medicine changed, so that what happens is the patient can have better gums and then their teeth will be stronger.
Yeah. And normally, how do the people react to the treatment? Because you say, okay, this is the problem and this is a longer term treatment that you have to go through. Do people accept it?
The dental treatment?
Yes.
Yes, yes. So what happens is we chalk out the treatment plan right at the start. You know, at the first visit, we have everything written down, and then we have to check the progress of the patient. Some patients realize it's for their good health, for their good, and that their health really changes. Sometimes their bad breath stops. The teeth that were moving stop, increasing to move. So everything is in check. So I think they abide by all those treatment plans.
And cigarette smoking and, this pan chewing or whatever it is, does it affect your teeth?
Yes. So cigarette smoking causes a lot of stains on the teeth, and also I have seen that there are people who smoke cigarettes, many chain smokers, their teeth also start shaking. So they have premature loss of teeth when they are young. That is one thing. Pan chewing has led to a lot of precancerous conditions. If there are some patients who eat pan, they cannot open their mouth more than 1 centimeter.
Is it?
It's stuck, because they have some fibers which are formed on the inside of their cheeks. But some of them are blissfully unaware. They don't realize that the mouth opening has changed.
But most laborers, they cannot do without
Yes.
chewing the pan.
that's the sad part, because that's where we have to educate them on that aspect of oral cancers. In fact, I tell them sometimes they see those pictures on their packets, like cigarettes and even pan, they have those gory pictures of cancers.
Yes, yes.
I always say, do you think it's been put there for fun? I said, this is reality what happens, because sometimes you can't come back. They have to go in for treatment wherein they cut their jaws,
Is it?
or their tongue has to be cut off because of the cancer. So it is what it is. It happens. I'm not trying to scare them. They have to be scared on their own, because that's the way cancer progresses in the mouth.
Yeah. What would be your general message for the people at large? How do you take care of your mouth and especially the teeth?
Okay. Your mouth is the gateway to the rest of your body. Just like you would like your body to be clean at every moment, your mouth has to be clean, which means your teeth have to be cleaned. You have to visit your dentist at least once every 6 months to have clean teeth, because your dentist will be able to teach you as well how to maintain it. And from there you will be able to find little things that can be treated at an early stage. And you will realize that you're doing yourself a favor by having good teeth. Keep taking care of your teeth. Brush twice a day, after breakfast and before you go to bed at night. Floss at least twice weekly. Use the interdental brushes if you have space between your teeth. Visit your dentist, and I think you will have a healthy life.
Thank you very much, Dr. Nadia. It has been an eye-opener for so many of us, and better late than never for those who did not know the techniques that you have shared. They are easy and they can be taken up by anybody.
Yes.
Thank you once again, Dr. Nadia.
Thank you very much.
Thank you to all of our viewers who have been watching this special program, and that is prevention, the key in dentistry. Prevention. And I think a visit to the dentist is a must. And should you need any help or advice, Dr. Nadia is always available. Thank you very much.